suggestions that have been made that at the end of the day, okay, because we are in the business, those of us on the fiscal management side, the public finance management side, of balancing competing objectives. Number one is that businesses keep complaining about multiplicity of taxes, okay? And in terms of the business environment, attractiveness of our business environment, this is one of the factors that weighs down Nigeria's, scores. And if we do not have a thriving economy with investors, investing in, hiring people and whatever, we cannot, we simply, all that we'll do will be multiplying the numbers of the vulnerable, and we can never then find enough funding to take care of them. So we must be careful that in this pursuit, we do not do anything that then, adversely impacts, business. So then we have company partnership. You can get companies to, especially as part of their CSR, to, basically partner with, the VGF. Then we have people who are called, ethical, investors, people whose, what's going on? I'm on slide 10. Anyway, we have people called ethical investors for who, when they invest, they seek, a larger purpose beyond just, profit. And such persons, can, come on board, whether it's through what we call social bonds or whatever, but such people can commit to, some of what will have, the returns that will have come to them going into the, the VGF. Okay. Okay. But then when we speak about innovative financing, it is not just about, I'm on the next slide, it's not just about new ideas for generating funds. It's also about reforms. It's about, changes, even in the way that we engage the conventional financing sources, so that we can attract much more, funds into the pool. So it could include changes to the processes of sourcing funds, introducing mechanisms that help improve collection, introducing systems that improve the use of the funds, or just changing the rates or the base on which the rates are, applied. And, a good example of that will be the next slide. Increase the basic healthcare provision fund to 2% of CRF. I personally favor this over trying to tax, many more items in order to think. Some people have suggested, take a portion of the VAT and they, earmark it for the VGF. Some have suggested, take a portion of the excise tax on alcohol and tobacco and earmark to VGF. But you see, at the end of the day, all of those taxes, all of those sources of revenue, they end up in the, the consolidated revenue fund pool. So when you apply a percentage to the consolidated revenue fund, as the BHCPF does, you are actually already, picking up bits of those. But if you're doing that and seeking to do the other one again, what then happens? You just have a multiplicity of, and what it does is increase the, the tax, burden on business, and in a way that it just looks like there's, too much that they're being asked to deal with. So, but not just increasing the BHCPF to 2%, but also the base on which this is. Currently, that law, the National Health Act, makes the BHCPF chargeable at the rate of 1% on the Consolidated Revenue Fund of the federal government. If we change the base to, whether it's to keep the 1% and change the base to the federation account, okay, or if that's all that we did, we could easily double, because what it means in the federation account, the federal government takes 52% of the federation account. Between the states and the local governments, they take 48%. So that's almost half of it. Right now, the states and the local governments are shielded from the burden of contribution to the BHCPF. And as we often remind people, the constitution that we currently operate in Nigeria actually does not give the federal government any responsibility for health. Health is not in the exclusive legislative list, which will make it the responsibility of the federal government, nor is it in the concurrent legislative list, which makes it a joint responsibility of federal and state government. It's actually in what is called a residual list, which means it is constitutionally envisaged to be the responsibility of states solely. But the reality today is that the federal government is shouldering, a much heavier burden of health provision for the people, and this is not sustainable. States must, contribute much more significantly to healthcare funding. And one way to do it, if leave it as we have done, continually to the discretion of the states, all that will happen is they keep just shaking that, burden, and the federal. So that's why I'm a strong advocate for changing the base to the federation account, so that compels everybody to contribute. And if we did that, we could very easily quadruple the amount that currently accrues to the BHCPF, and by extension, the portion of it that then accrues to health insurance. Okay. So what are the next steps as I see? Again, I think that the mandatory contribution to health insurance must be driven. We can see from other country experiences that that is, absolutely critical. Okay, social contribution to, health care is important. Even on the continent here, we see Ghana is making significant progress. Of course, we know that Egypt is way up there in terms of this as well. For Nigeria, growing social insurance contribution is critical. If you take for 2021, aggregate remuneration of employees, and this is what is on record, probably given the large size of the informal sector in the country, the reality will probably be more than this. But even then, at 46.11 trillion naira, if the 5% contribution of that split between employer and employee, and assuming just an 80% collection efficiency, would amount to about 1.84 trillion naira based on the 2021 employee remuneration numbers. 1.84 trillion naira is 160% of the total FGN budget for health in 2023. So I think that this is clearly one that we must drive. We must, and I'm pleased to hear that there's a committee looking at how we can move this from now just legislation to actualization. Okay, so let's go on, and then we need to Nigeria move from the Bismarck social health insurance system, okay, to make sure that everybody is is covered, okay. Given, as I said earlier on, we have a huge informal sector, and therefore we must expand to expand health coverage. The health insurance system in the country must be extended to the informal sector. Still on next steps, domestic resource mobilization is something that we must continue to drive. And as government revenues grow, that percentage, whatever it is, of the Consolidated Revenue Fund, which is dedicated to NHIA, grows. So this, this group that is leading advocacy, or NHIA, must understand that there is, therefore, between growing government revenues, getting people to pay due taxes when due, and growing the size of the funding available for NHIA. And so, as you invite us on the finance side to partner with you, in your advocacy, I'm also extending, an invitation to you to partner with us to see the advocacy for improved compliance with, tax rules and government revenues as a win-win for finance and health. Okay. So we have implementing what we call the strategic, revenue growth initiatives, and there's lots of measures to improve government revenue, entrench fiscal prudence, and achieve better value for money. And these measures would positively impact the BACPF and government ability to intervene in the health sector. So that's basically my plea. Then, of course, still on next steps, as we do this, we must keep our eye on value for money. Okay? If we don't, we will lose public enthusiasm and, for these, initiatives. Okay? We said, I've talked about records, so transparency is critical here. Okay? Beneficiaries must be well documented with involvement of relevant external, stakeholders. The result from the application of the fund must be documented and published in a professional and transparent manner. There must be accountability for results. I'm already, finished the next slide after this, and you're still on this. Okay. In conclusion, the recent trend shows improved federal government transfers for health insurance, especially with the operationalization of the BHCPF. The introduction of the VGF is a key source of increasing coverage. The telecom tax alone could generate over 100 billion naira to the VGF. That one, kobo per second. I don't know whether to say thankfully or whatever. Nigerians talk a lot. The Nigerian telecom companies, the average, revenue per user, what they call the ARPU, whatever, is quite high. You get to talk, and that's why, because in other places, if somebody picks up the phone, at best he says hello and gets on with the business. In our own case, we say hello, how was yesterday, how was the night, how is family, how is it today? before we get on to what we have to this thing. And that's good now for NHIA because, funding constraints, however, remain a major challenge, and therefore efforts should be made to ensure innovations in funding of the VGF. To achieve greater access to available new innovative funds globally, there is need for improved performance, value for money. And I say that again and again. And this is really important. Value, money, proper accountability, transparent, systems. Okay. There is also the need for close collaboration and information sharing between critical stakeholders, especially the Ministries of Health and the Federal Ministry of Finance, Budget and National Planning, to ensure success and sustainability of any innovative financing mechanism adopted. There is the need to, one, do clear assessment of its real impact and added value, while benchmarking with other alternatives in terms of technical feasibility, stakeholder support, fundraising potentials, and cost. I'll give you an example. When the Police Trust Fund was established, some people thought it was a fancy idea to introduce a levy of 0.0005% on the profits of companies towards that. When you aggregate what can come from this in a year, it's under £1 billion. But this is such aggravation to companies that every company needs to now in their tax return begin to compute 0.0005%. So in terms of what you actually, the fundraising potential of such doesn't add too much. But what it does is irritate your stakeholders who feel, okay, they've already whatever this is. So when you approach them for more, tangible, partnership or contribution, they feel that whatever they've already, been pestered enough about that. It becomes an irritation. So we must be mindful that as we explore these, innovative mechanisms, we do not irritate our stakeholders and put them off. Okay? Finally, there should be an evaluation of the mechanism in terms of effectiveness, ownership, predictability, and extent of its being result-based and pro-poor. The innovative mechanism must complement, not substitute, existing funding sources. Okay? And then appraisal during implementation should be done to enable fine-tuning, that will help sustain impact and or enhance results. Thankfully, the Act mandates the Council of the NHIA to keep this matter of funding the VGF constantly under review. I thank you for your kind attention.
Okay. Thank you so much, sir. Thank you very much indeed for that very profound presentation. The next speaker, ladies and gentlemen, that I have the privilege of inviting to the podium has 30 years post-call experience, over 30 years post-call experience at the bar. And you'll be hitting the nail on the head if you described her as a legal luminary. She's also the chair of the NHIA Mandatory Health Insurance Committee, as well as being the General Manager Legal Services of the authority. So ladies and gentlemen, please, I would like to yield the podium to none other than Barrister Blessing Nyenge. Her presentation is on the mandatory health insurance from legislation to implementation. She's going to give us the journey so far. You're welcome, ma'am.
Good afternoon. The DG of NHIA, the DG Budget Office, the MD of Nigeria Health Watch, traditional rulers in the house, everyone that is in this hall, I acknowledge your dignity and I say good afternoon. I have been introduced as Blessing Nyenge, and my paper is on the mandatory health insurance from legislation to implementation. And the theme, of course, the theme of why we are here is on implementation, accelerating it. So my paper goes in line with that. And I am mindful of the fact that the time allotted to me is small, so I will abide by it. And that means I will be summarizing what I have. I have so many slides, but so that I'm not caught up with time, I will summarize what I have. The outline is there for all of us to see. The introduction, the major highlights of the Act, mandatory health insurance, implementation, the journey so far, preliminary feedback, and then I'll conclude. Of course, we know, all of us in this hall, I presume we know the NHIA. Who are we? We came into existence a long time ago, precisely in 1999, when a decree was promulgated, and we have been in operation since then. And right from the promulgation of that law, we have clamored for a review of it. It was mentioned earlier, I think by the DG of NHIA, that a lot of efforts were put into this, but we didn't yield, the efforts did not yield much until last year. Last year, 19th of May, 2022, that the President of the Federal Republic of Nigeria, President Buhari, assented to the NHIA Act 2022. As I stand today, and as the operation exists today, we are drawing our muscle, or we have muscle drawn from that act. Our operations are abiding with that act in conjunction with the operational guidelines that will soon be made public. So that's who we are. Already I'm done with the first slide. That's who we are. Of course, the law that I cited, NHIA Act 2022, did not just come. It passed through the National Assembly. It was a sponsored bill, and it went through all the processes before it got its assent. I'm done with that also, so we'll move to the next. What are the highlights of this act? There are so many highlights, but these are the ones that, for the purpose of this dialogue, we'll be looking at. The mandatory health insurance, the vulnerable group fund. As a matter of fact, and to lay emphasis on the VGF, and to show that government is mindful of taking care of those who cannot afford to purchase health care, 6 sections have been allocated for just VGF. If you look at the NHIA law, from section 25 to 30, or thereabout is about VGF. The introduction, sources, and the last speaker even mentioned some of the ways that we are going to fund. So all of those are under those sections that I have mentioned. Then the mandatory health insurance, which is on our lips today. Before now, it was voluntary. Now it's mandatory. What does it entail? It entails carrying everyone along and leaving no one behind. And we can draw that from sections 3B and sections 14 of the Act. Conjunctively, you will see that the law says, let this, either participation or otherwise, be compulsory. Every Nigerian should participate. This is for health is wealth. We all need to be healthy. And the law takes cognizance of that, and hence that provision. So, but how are we going to do this? That is the tall order, and that is why we are here. We are here as partners to see how we can do this and move this forward and ensure that this is implemented and ensure that the universal health coverage, which is also on our lips, is achieved. What are the benefits? Of course, I mentioned earlier, if you don't leave anyone behind for health care, your country or you are good to go, because a healthy nation is also a wealthy nation. A healthy workforce is also very key. So we will not leave anyone behind, I'm repeating, and we will facilitate private sector participation. Before now, we have seen in the years of operation that there are some private organizations, OPS precisely, that are reluctant, and they don't pay attention. Attention is not given to participation in health insurance or purchasing on behalf of their workforce. But now it is mandatory, and they won't have a choice than to enroll into this. We will also facilitate integration and not fragmentation. The unifying factor is the NHIA now. These are just the steps. The gazetting was mentioned. Presidential assent has been mentioned. After the assent, there were some steps, key steps that we took as an organization. First of all, we got ourselves acquainted to the provisions. You know, law, before you talk about law, you must know the law to cite the law. So we started at that level, the level of bringing management together, the level of bringing staff of NHIA together to sensitize them on this piece of legislation. So we did that, and we moved on. They also stepped down trainings to their various organizations, offices, offices, state level, zonal level, and all of that. So there were step-down trainings that we did. After that, we engaged our stakeholders to acquaint them and sensitize them on this provision of this legislation. We did that, and we did advocacy for financing the VGF. You know, I said earlier that it's a tall order. It's something that requires all hands on deck. So advocacy we did at the initial level, we will still do and will continue to do, because it will pay off at the end of it. These were internal committees. Now they are externalized. We have brought on board people, agencies, those that will help us to drive this, those that will help us in the implementation. So now committees have been formed. Earlier, the DG mentioned these committees, but I can still mention. We have committee on mandatory health insurance, we have committee on innovative healthcare financing, and we have committee on promulgation or drafting of the operational guidelines for the scheme. So what are they supposed to do? Desk reviews have been done, and we are, please can we move on? Have been done, and we are still meeting. Sooner than later, you will see the full outcome of the work done by the committees. These are the committees that I mentioned earlier. They were inaugurated on the 28th of March, 2023. And members that we have here are not just restrictive to these members. We still have people, but I can mention the ones that we have there: Federal Ministry of Health, Primary Healthcare Development Agency, Forum of Chief Executives of State Social Health Insurance Agencies, Health Maintenance Organizations, SCPAN, Office of Attorney General. We can go on and on. Corporate Affairs Commission, Federal Inland Revenue Service, and all. We are sitting together to ensure that this does not just stop at assent, but goes to implementation and is done in good time. Can we move on? So briefly, I just want to acquaint you with what we have. They are like submissions that have been given at this point. This is not the final point, but for now, these are the preliminary feedbacks that I can give to this noble gathering. We have, I mentioned advocacy earlier, to Nigerian Governors Forum and some MDAs. We are looking at secularization of this piece of legislation so that there will be ease of operationalization. With that, 90% of the problem will be solved. That is our thinking. The secularization we're looking at is expected to come from the office of the Secretary to the Government of the Federation, directing OPS and federal government workers and all of us to key into the National Health Insurance Program. If that happens, 80% or 90% will be solved. We are looking at collaboration and coordination between the demand and supply side agencies that is coming together for seamless implementation. I mentioned earlier that this is tall, and if you leave us alone, we will not be able to achieve or implement this beautiful legislation. Working with other agencies to make health insurance a prerequisite for driver's license, international passport, business registration, bidding for contracts, political appointments. Before you pick up your form, you will show evidence that you have enrolled into the National Health or you are a participant in the NHIA. So we are looking, this is not exhaustive, but this is what I can present to you now. We are still brainstorming and looking at ways, other prerequisites, areas that we will catch our people and drive towards universal health coverage. Harmonization of databases for seamless integration and adequate monitoring. And like I said, we can go on and on. This is for the purpose of this meeting. And we are looking forward to your support. We know we cannot do this alone, and we know that mandatory health insurance is new. Before now, we didn't have this. But studies have also shown that countries that are operating mandatory health insurance have gone closer to universal health coverage. So why are they leaving us behind? These are the burning questions, and we know we cannot do that alone, except you will support us. Finally, I want to say that it's of paramount importance to note that since the signing into law of NHIA Act on 19th May 2022, a lot of effort has gone into developing a reliable and sustainable framework for the implementation of mandatory health insurance. The foregoing details are therefore inexhaustive, and it is work in progress. And we thank you for your past, for the present, and the anticipated support. Thank you all.
Thank you, Barrister Blessing Nyenga, the General Manager, NHIA, for that expository presentation on the NHIA Act 2022. We look forward to its full implementation. To take us further for the next presentation, I'd like to invite the Chief Executive Officer, NOI Polls Legal Department, for the presentation of findings of the NOI Polls Public Opinion Poll on Health Insurance. Please join me to welcome Dr. Chike Wangu. Thank you.
Good afternoon, everyone. Let me follow everyone in acknowledging the presence of the DG, NHIA, the MD of National Health Watch, the DG Budget Office, as well as His Royal Highness Esu of Jikoi. I'm also saying a good afternoon to all the dignitaries here and standing on existing protocols. My name is Dr. Chike Wangu. I'm the CEO of NOI Polls, and we had a poll on national health insurance coverage, speaking to average Nigerians just to get their opinion about national health insurance. And the main fulcrum of our presentation is that we can say, as at when we conducted this poll, that health insurance remains a mirage to many Nigerians, as much as only 17% of the people that we spoke to claim that they have some form of health insurance. I'm very much aware of time, so I'm just going to present maybe 6-7 slides to just highlight what we found, but it's going to be enough for us to have a robust conversation on the way forward. Before I go into the presentation, I also acknowledge everything that has been spoken before and say that I'm extremely happy that this dialogue is happening, because I think it's really critical for us to drive health financing in this coverage if we're anywhere near achieving our goal of universal health coverage. So just as an outline of my presentation, I just have 3 main points. Introduction of NOI Polls, so we understand where this data is coming from. Key highlights of our methodology and findings, and then just a couple of recommendations based on what we found. So a bit about NOI Polls. We're a Nigerian-based opinion polling and research organization founded in 2006. We do a lot more and cut across several sectors, but we're discussing the health sector today. We have a 50-man polling center, and we have an active database of about 70 million active Nigerian numbers, which should include everyone here, I hope. And we do quite a lot beyond this, but 3 of the works that we've done include works around some of the partners that we've seen there. So let me just move straight on to the reason why we're here today. Next slide, and the next one here. Okay. So just to give us a bit of background why we did this in the first place, this was in reference of the Universal Health Coverage Day of 2022, which had a theme of Build the World We Want, a healthy future for us all. However, that said, this kind of boils down that the world where we want is where everyone should have access to quality health care whenever they need it without suffering financial hardship, which is the goal of universal health coverage. So we did conduct this opinion poll to feel the pulse of Nigerians regarding health insurance coverage in the country. The poll was conducted in the week beginning November 14th of 2022, and as our usual methodology, it involved the telephone interviews of a proportionate sample, nationwide sample of 1,000 randomly selected phone-owning Nigerians aged 18 and above. We can only speak to adult Nigerians. And these numbers are representative of the 6 political regions as well as the 36 states and FCT of the country. The interviews were conducted in the 5 popular languages, Igbo, Hausa, Yoruba, Pidgin English, as well as English. And just as because we're speaking of numbers, although we can say with 95% confidence that the results we obtained were statistically precise with an error margin of plus or minus 5%, we recognize that the exclusive use of telephone polling has its own limitations of excluding non-phone-owning Nigerians. However, the country's teledensity is above 100%, and this is as reported by the Nigerian Communications Commission. So we feel that the telephone polling is appropriate for this kind of work. Also, given the rigorous process of randomization and stratification, we can confidently stand by the validity of our method and our findings. Thank you. So next slide. Because of the time that I have for this, I'm not presenting the whole findings. I'm just cutting short what we think is really important for this conversation that we intend to have here. And the first thing I wanted to establish is, where do people actually go to seek care when they fall ill? And the first thing that we asked, the question was, which healthcare facility do you or your family members visit when you're ill? And the point that we're trying to show is that whatever the situation is, majority of Nigerians still access healthcare from the public health facilities. So in all that we're speaking, we need to be sure that whatever we do cover public health facilities. And if you look at the distribution across the geopolitical zones, you see that with the exception of southeast, south-south, and maybe south-southwest, majority of our population still access healthcare from public health facilities. Next slide. And then the critical question we asked was, how do you pay for healthcare? Only 17% of the people that we spoke to said that they have health insurance coverage. 80% still pay out of pocket. And let me state that when we say out of pocket, it includes I pay for it myself, my friend pays for it, my family, whatever, that they're just paying out of pocket for that health service. The point that the key takeaway is only 17% of the people that we spoke to acknowledge that they have health insurance coverage. And this suggests that health insurance still remains very low in Nigeria, and this is the reason why we're having this conversation today. Next slide. When we went further to ask the 17% that have some form of health insurance, what type of health insurance cover that they have, 75% of those that we spoke to had a health insurance coverage from the National Health Insurance Scheme. Only 17% mentioned the private health, HMO, and then others. It's again important to look at the distribution across the geopolitical zones and see that there isn't much difference except maybe with the Southwest, where 42% of the people that we spoke to mentioned that they have private health insurance. Still, overwhelmingly, the NHIA covers the most number of people that say they have some form of health insurance. Next slide. And finally, on this whole fact-finding, we did ask, are you satisfied, the 17% that do have health insurance, are you satisfied with the service provided by a health insurance provider? And 82% of people that we spoke to said that they are satisfied with the service that they receive. So the key takeaway from this point, before I go to the final 2 slides that I have, is we do have a very low proportion of people that say they are covered. But of the people that are covered, the NHS is carrying most of the NHIS is carrying most of the load. And whatever challenges the health insurance coverage has in Nigeria, majority of people are still satisfied with whatever service that they are receiving. So the next slide, it's a few points of recommendations that we have to, that we're trying to make on this. So the key point that we are asking is, of those that, the 80% that say they don't have any form of insurance, we went further to ask them, are you aware of the National Health Insurance Scheme? 51% are aware, 49% are not aware. So in terms of what we do, how do we turn the National Health Insurance Act into implementation? One of the key things that we have to focus on is on awareness, to be sure that people understand what this is all about. Again, if you look at the geopolitical zones, you see that there isn't much difference between the zones. I do want to make a critical point from our experience in this polling in terms of how this awareness drive should go. It's important that we understand what we call trust in government. So it's important that when we're trying to make this awareness campaign, that there is a very deliberate approach in the stakeholders that we decide to talk to people about these things. And the reason why I'm pointing this out is from my experience during the COVID lockdown period or everything. You could see a lot of distrust of information that is coming directly from government. And I'm going to give a very practical example to drive home the point. In a series of questions, you're speaking to a single respondent, and you're asking the respondent, do you think the numbers of people testing positive to COVID is low or high? And the person tells you, the number is very low. I think the government is trying to hide the fact that COVID is a problem. You record that, and you go further down, and you ask the person, do you think that the numbers that are being reported for palliatives is high? The person says, I think the government is overblowing the number so that they can get more aid. It's the same person in the same conversation telling you the numbers are being reported low, the numbers are being reported high. And our interpretation of that is that the person just doesn't want to believe whatever is coming out from that particular source. So it's really critical that as we try to push this mandatory health insurance coverage, that we take very deliberate attempt in how the awareness is created, because that is going to be the first step to whether people are going to be receptive of whatever interventions or innovations that we're trying to push forward. On the flip side, the final slide that I want to say is Nigerians are willing to pay for health insurance. So despite whatever misconception people might have, 57% of those that we spoke to said that they are willing to pay monthly or yearly for them to be able to access health when they need it. So those are the things that we need to take away from these points that I'm trying to raise. One, health insurance is low, but people are willing to pay for it. So finally, in conclusion, I'd like to say, next slide, please, sorry. Our poll showed, as at November 2022, an urgent need for interventions in the Nigerian health system to reduce the incidence of out-of-pocket health expenditure. The proportion of the population covered by financial health risk protection and healthcare utilization is too low at 17%, as reported by the people that we spoke to, compared to a benchmark of 90% for an efficient health system. And this reflects how far we still lag behind in the race towards universal health coverage. There is a need for definitive and deliberate approach towards mass enrollment of Nigerians by relevant stakeholders, as well as intensive sensitization, as almost half of Nigerians disclose that they are not aware of the National Health Insurance Scheme. However, 57% of the unenrolled say they are willing. This is without them having the full information of what they need to do, but they are willing to pay for health insurance. And this will go a long way in reducing the incidence of out-of-pocket payments and incurring catastrophic health expenditure. Thank you.
Thank you, Dr. Chike Wagu, the CEO, NOI Polls. We would once again reshuffle the agenda. We're going into our panel sessions at this moment, and we would take the second panel session on the agenda first. So to have this panel session tagged Exploring Strategies for Expanding Mandatory Health Insurance Coverage to the Missing Middle, want to discuss how this health insurance coverage will reach the informal sector in Nigeria. Please join me to welcome the moderator for this session, Chibike Alaboso, Senior Program Manager, Nigeria Health Watch. Thank you.
Thank you very much, Kachi. Really excited to be here today to moderate this important conversation. And without further ado, I'll go ahead and invite our panelists to join me on the stage. Please, can we settle down so we can proceed? Thank you. So please kindly join us on the stage. His Royal Highness Etsu of Chikoyi. Please, as he joins, please welcome him with a warm round of applause. And I also call on Mrs. Helen Angoreka, as I said, to join us on the stage. Please welcome her with a round of applause as well. Thank you so much, sir. Thank you. And to also join us here will be Prince Nnamdi Epuna. Please welcome him with a round of applause. And finally, we were meant to have Mrs. Felicia Sani, but I just got the information that she's unwell and has to be hospitalized. So can we have her representative please join us on the stage? Thank you. All right. So we've been having these important discussions this morning about health insurance, universal health coverage, and how to achieve that for Nigeria using different innovative means of financing to make sure that nobody is left behind, as we've been hearing since morning. But the interesting thing with this conversation is we have we had the DG of Budget Office talk about the Vulnerable Groups Fund. So there are conversations around how to help them, how to get funds to make sure that those people are not left behind. The poor, women, and all of those people classified as vulnerable. But then we also have the formal sector, people employed in government and organized private sector. But then in the middle, there are people who are in the middle. Okay, I came across a report from R4D yesterday where they called them an interesting phrase. Said the informal sector, but non-poor. Okay, so they are the informal sector, but they can afford to pay for insurance. And that's the missing middle. So how do we make sure that all of these people are, the conversation, we are carrying them along and we are getting the funds that they have to, push our healthcare sector forward. As we had the DG, it's important to have those fundings, those monies, those premiums that come from the informal sector, especially those who are in the middle, those who can afford to pay for these services. And I'm really delighted to have really important guests in our midst today to share light, because it's important that we listen, to them, not just profile solution. The Barrister Blessing has already talked about some of the guidelines that they are working on, but it's also good to hear from them so they can speak to what they are, because they understand their context better and what their challenges and how to move the sector forward. So really delighted to have you all here. I'll start with you, Your Royal Highness. So in your experience, leading your community, what are some of the significant challenges or health challenges that the community members face or that you have seen over time leading them?
Thank you so much.
Yeah.
In the community, with the movement of activities, the challenges are numerous. In the first instance, I want to appreciate the organizers of this program for reaching to the grassroots, to allow the grassroots to participate in sharing the experience. One, our system of sensitization have not been very adequate. Many people, you will be surprised that down there in the grassroots might not even know what this health insurance is all about. I think we need to break it into local languages, because the language spoken, like I'm using English now to speak, if you were speaking Hausa, or Bagi, or Igbo, or Yoruba, it has a kind of force to impact into the hearers who understand that particular language. So language usage should be considered. The environment where we live, communication is not, like I've said, properly done. That is why I said there are numerous challenges. Many people over there in the community, sometimes they feel that they want to still try what they have done in the 70s, in the 60s, which is not applicable today. In the 70s or in the 60s, you will be surprised that there was no what we call Maggi in the 60s. But today we take Maggi, we take Indomie and other things. There were not all these things. The system in the body need a thorough attention. Proper attention is not given to the health care system. That is negligent. Someone can be having health challenge and he does not even care to know what it is all about. He believes that, my grandfather had such experience and he was able to escape through. Nothing happened to him. How your grandfather lived may not be the same pattern you are living today. In those days, people trek from one distance to another, which we don't do today. As I was coming here, I did not just start trekking. I entered motor and I came here, which has reduces the power of exercise in me. And so the challenges we are facing today, they are challenges that we need to modernize them. We are living in a digital world, that things need to be done. We improve the neatness of our environment. We allow people to know what health is all about. And then to go closer and do it, participate, touch it, and know what it's all about. Some people look at it as a dream. They look at it as a big man something. It's somebody who is coming from London. It's somebody who is coming from US that can participate in that. It's for me and you, and it's for everybody. Thank you.
Thank you, Your Royal Highness. So I'll get back to you on that, because one thing I hear you say very strongly is sensitization. So getting people to understand these issues in a way that they can relate to it. So I'll jump to you, Prince Nnamdi. You lead the painted Abuja taxis here in Abuja. So in your own experience as well, what are some of the ways your people perceive, your community perceive health insurance? What are their thoughts? How do they see health when you have conversations, or if you do at all, around health insurance?
Yeah, thank you very much. May I stand on the existing protocols, please? And I want to thank you, the organizers of this meeting. We've been attending such meetings on health insurance, and we've done a lot by trying to sensitize our drivers. Okay. We have periodic meetings with them concerning this very scheme. And initially, it was like a tale to them, because what a driver believes is enter his vehicle and pay him his money. Any other story you are telling him is like a tale. You don't blame them for that so much, because I would say they've not really have that confidence in the government or the system. Let me put it that way. They believe they are abandoned, you know. They are not carried along. And, you know, it takes a patient person to really organize or lead the drivers. If you are not patient, you cannot do that. So we've been trying to really pass the message in their own language, not in the language of the government, because if the government really wants to achieve this, it has to achieve it with the stakeholders. I think that is the positive side of it, that what you people are doing, you are really trying to make sure that you achieve this goal. And I think I appreciate that, and I would also want you to do more by also trying to see how you can look at the welfare of these drivers. Because without the drivers, I don't think you can drive this economy. You know, they are moving people, goods and services. They should be recognized by the government, and also giving that hope in the society they belong.
Thank you.
Now we are trying to let them know that, no, their mindset should, you know, not be one-sided. They should look at other things that government are trying to do for them, like fixing roads and then other things. But the major, primary welfare of a driver is neglected, which is, one of it is even the health of a driver. Because let me tell you something, you may look at driving job as a minor among all jobs, but let me tell you, it's a very critical exercise. Driving, the whole part of your body is working. Your senses are working, your eyes are working, your mouth, your ear, you want to talk to your colleague, you want to, you know. So at the end of the day, when you see them react to some certain situation, it looks as if it's a lunatic that is reacting. But it's the stress they pass through every day. So government should look at how they can cushion some of the burdens that they are carrying. It weighs down at times. So it's easy to get them into this scheme. At least from our own record, there are some already who are even doing contributions for it, okay, by their unit heads. So that is one positive side of it. But on the other hand, I don't know what the organization is going to do for them to cushion. It's not everybody that can afford that, honestly.
Thank you. We'll get back to some of your recommendations on how to drive that forward. But approximately, how many people in your community? Just quick.
Well, we have more than 5,000 drivers.
Okay.
We have more than 5,000 drivers by our biometrics.
All right. So, Mrs. Helen, you lead the Deaf Women Allowed initiative, and I am interested to know, what some of their experiences are. assessing health care. What are some of the stories that you've heard or, that you've also experienced when it comes to deaf women or people in your community assessing health care?
Hello, everyone. I want to thank you for this opportunity to be here and to speak for my community. You know my name already. When we talk about challenges in assessing the national health insurance, honestly, the health access itself is difficult for persons with disability because each disability is peculiar and there is discrimination already. But as a deaf woman, we face like triple the challenges because of the difficulty. We don't have information about access. Even a person on a wheelchair that has information about access, how accessible is the health insurance office for a person living with disability? And the person who is going to register them on the scheme, would the person not be discriminatory at them? Would the person know how to carry their needs? Like seeing a person with a wheelchair and giving that dignity. And then we're also talking about information because there's no sign language information. So if I look at the TV or the radio, I don't understand what you're saying. So is your message about the health, national health information, is it carried in sign language? If it's not, then you've been excluding us. Then if you're talking about other information on it, you now look at the blind people. They need Braille materials to know some of these services. So there's stigma, discrimination in every aspect of the scheme. And these are the challenges because our women do not have money to access healthcare. Think of them being pregnant and going to the hospital. They want to pay for this service. And the health providers are saying, as a deaf person, you're not ashamed. Who did this to you? As if they are not women. So we have the right to these services. But when we're not included from the beginning, then the perspective of the society is different from us. So I just hope that these challenges will stop. If the National Health Insurance Scheme is for everyone, then it's high time you start hearing us. Give us that information. It's important. Information is power. That's the only way we can access care. That's the only way we know that this national health insurance is for us. And remember that the WHO says that every 15% of every country's population is a person with disability. So it means that we're over 35 million persons with disabilities. You cannot neglect this number because you have to carry everyone along. So our challenge is when people see us, maybe persons with physical disability or whatever you like, you can't employ us. How many of us are working at the National Health Insurance Authority that will know how to impute our needs when they're making policies? We're not there, so we're already left out. These are part of the challenges. The attitude of health workers and people working at the National Insurance Authority. These are things that we face with every day. Thank you.
Thank you so much for sharing that. So we usually imagine these things. I also do imagine how, they access services, people with disability, especially deaf women. I told some of my colleagues and friends that my sister, when she gave birth, she has 2 kids now, and she is deaf. So here in Abuja, she stays in Owerri. I kept wondering how was she able to go through that? Because I know in the hospitals, there are no desks to explain some of these things to them. So I think at the end of the day, because one recurring theme I'm getting here is access to information, breaking it down that people, in a way that people will understand. These people, these communities, we're not talking about the formal sector now, people who understand all the technicalities, or we're talking of people who are in the informal sector, but they are not poor. They can afford some of these things, but they need to get the information in a way that they can relate with. So I hope it's also one thing that we're taking away from here as we're going back to our respective organizations and continue this push. Ma, we'll get to you from a very important community as well, because I'm sure as we're living here, some of us you have plans to go to the market, to go for grocery shopping. If you don't do it in the, in the fancy places, really important community, the Market Women Association. Ma, just a simple question for you. Your fellow women, the people, and when we say market women, I'm sure there are also men in that group, or is it just women? Is it just women? No. Okay. So your community, your members, do they understand what health insurance is? When we talk about health insurance, buy health insurance, do they understand what it means?
Thank you very much. I want to say the Chief, Mrs. Felicia Sani, the President of Market Women Association, OOM, say I should thank you, everybody, and the people that bring this health insurance to make the market women to know what is health insurance. Where we are hearing, let me come down for our tomatoes and the Gary seller. English. Thank you very much. We are hearing about health insurance. And when something comes out in that way, because of our market, early morning we are in the market, from morning to night we are selling our market. Sometimes the news will call us, what is the meaning of health insurance? I beg, we just know it to do health of motor or all those things. So we are not putting our mind in that health insurance like that. So where Mama now call us that Mama's supposed to be here, but because of the doctor, because yesterday they booked Mama for the hospital, maybe the doctor is not attend Mama quick, that is why it's not be here today. So the health insurance that you people are saying, we market women, I believe that where all those news come for the market women, I believe that we will support this health insurance to make our people to be know that to take care of ourselves is very important. To know that our people to take care of our children, because sometimes you prepare your market, your daughter or your child will say, "Mommy, headache or stomach," you say, "Go and buy paracetamol." We don't care for all those ones. So, but because of this program, I know that our people will know that to take care of our health is very important. And I thank you people for this organizing. Thank you.
Thank you. So because of time, we'll just run through one more question for each panelist and we will close the session. So I'll come back to you, Your Royal Highness. You started with saying, talking about sensitization, making sure that this information gets to the people in a language that they can understand. What are some of your recommendations? The people, the partners who make these things happen, they are here today. You heard the DG of NHIA, the DG of Budget Office. So even if they are not here now, the DG of the Budget Office, his people are also here that will take these recommendations to them. The DG of NHIA is here, okay, listening to you directly. We have other partners, stakeholders who help to make these things happen. So this is not just a talk shop or just for talking's sake. What will you recommend that they can do? And also your own commitment as a traditional ruler to make sure that this information gets to the people, people understand these things, and most importantly, they buy into it, to make sure we have enough money to drive our health sector forward and make sure that they all have the health care that they deserve.
Thank you so much. Health is wealth, they say. And I believe that it is a healthy person that runs his normal activities on the usual way. When you are not healthy, you are like someone between God and life. Definitely, like you have said, I would wish to suggest we should go back, one, to create more chances from the lectures we have received from various speakers, to be able to bring the mind of the people, like I have said, to sensitize people to let it known to people more and more than before. 2, the language usage, like I have said, is very important. And also, let us go into a deeper understanding and assignment. Like if you go to some of our communities, you will see that our youth, they go into doing things that they don't want to do because they are not directed, they are not taken on a serious note. They look at their senior ones who have graduated from school, they have nothing doing, they go about taking drugs, eating, and doing all kinds of criminal activities. On a serious note, sometimes I look at our society comparing to some other international world organizations. I look at ourselves as people who need to go into understanding what real health is all about. It does not exempt anybody, whether you are educated or not educated. It does not know whether you are old or young. So it is for us to move the machine closer. It's just like this organization or this program now, where we are seated. If I didn't come to participate and to understand what this program is all about, I've been hearing about it like a tale, like you said. It does not sound very deep like today. It has made more meaning to me, and since it has made more meaning to me as a leader, I will go back and move the idea with my community and extend it to other communities, and then bring to the board people who think they don't care about their health. In fact, our system needs to be corrected. The scientists will say the thinking brain, medulla oblongata. Our system needs to be corrected. On a serious note, we need to come back to know where we are coming from and where we are going. And we should do it in a more sincere way. Many a times, assignments are being given to us, committed to us by human. As you serve your fellow man, you are equally serving God. Remember, whatever has beginning has an end. And whatever you are doing, you have your reward before man and before God. And we are going to be accountable for whatever we are doing. If you are doing your work in a serious way, in a sincere way, many people will be saved through your ideas. So we should go back and then move the machine closer and forward. I am ready as a traditional ruler, even if I'm giving the ambassador to go around the whole globe to tell people about this health insurance. I will sacrifice myself, my time, to tell my colleagues, to tell others, to bring them closer, to know the importance of this health insurance. Thank you. God bless you.
Thank you so much, Your Highness. Thank you so much for that commitment. And I'm really excited you mentioned going to the community, because it's also one of our strategies at NHIA Health Watch, organizing community town hall meetings. So it doesn't end, these conversations are important in places like this, but we also take it to that level. And we're happy to, continue that conversation on partnering with you to get to the community. Over to you, Prince Nnamdi. So quickly too, because we are really short on time, one or two recommendations on how to drive this conversation forward. And if you have example, of something that has worked in the past, because you mentioned you are part of these meetings, and I'm sure the drivers are an influential group, so I'm sure there are certain programs that have been pushed to you. So if you have an example of something that has worked in the past, of a message or a program that was pushed to your members and they bought into it, how did it happen? What made it work? Please share with us. Thank you.
Thank you very much. I think, like Esu just said, it is important to to have sincere of purpose in everything we do. And there is always confidence when you are trying to make people understand what they don't know by showing them evidence of what you are about to do. I think it gives them more confidence. There was a time we had opportunity like this to make drivers key into a certain project.
Okay.
I think what we did then with our partners then, we made them to brand with us, with our taxis, okay, and the dividends of the branding, the drivers keyed into that project. Okay. And at long last, many people who didn't have that opportunity to do that branding, I think they started keying into the project. So it's an incentive, you know, that can bring more of them closer to the idea you want to pass to them.
Thank you so much for sharing that example. Mrs. Helen, so you talked about information, you know, how this information are being put out. So sometimes they are not created in a way that targets people that are blind, people that are deaf. What one recommendation can you share on how to, you know, get this information to your people, you know, in a way that they can understand? And just like Prince Nnamdi, do you have an example of something that has worked before? Please share with us as well. Thank you.
Thank you very much for this question. You said I should share one, but I'm going to share more than one. Because it's key for everyone to be inclusive. And it's very wide when you're talking about persons with disabilities. So I'm going to try to summarize it. When we are talking about inclusion for persons with disability, actually it's not difficult. Remember, I said persons with disabilities are not the problem, but the society is the one disabling us. So from the planning stage, you have to include persons with disabilities and see what works for them. Now there is a national health insurance. If there was a person with disability in the committee, they would have known what would work for a blind person, what would work for a deaf person, and this awareness would have gone further than this. Like for a blind person, they need braille materials. For a person with deafness, the person needs to be able to see an interpreter for them to understand. So from the design stage, they need to be included. So what works for you will not work for a person with disability. It's like you're trying to cook porridge, and then at the end of the day, after purchasing the ingredients, you say you want to make vegetable soup. How is that possible? So from the planning stage, it will help us to arrive at where we're going. Secondly, to make message in accessible formats, remove the barriers that we have. Let information be coming from the persons with disability clusters so that it can reach our people easily. When you're thinking of passing information, think about including the community on how such information will be accessible to them. And then where your offices are, you have to make it accessible so that even if they know about the health insurance, when they come to access services, you need to train your staff on disability inclusion so that they'll be able to understand what works for persons with disabilities. Because if we come into your facility and you're not smiling at us, you're already telling us to go away. So if there is interpreter, and we have the Disability Rights Act already in place that has been passed into law since 2018. So very soon it's going to catch up with some people who refuse to include us in accessible services. So I'm just announcing this so people in the house who do not know will know about that. So what I'm recommending is that for the message to get to us, include us. That is it, so that we can get accessible information. So like today, my sister deaf is here, and you can see the interpreters, and they are interpreting. I'm a mother of 4 children here in Abuja, but I've never gone to the hospital and see a doctor or a nurse that understands sign language or an interpreter in the hospital. So when they are talking, I cannot hear them. And when I'm talking, they cannot hear me. And if I get angry, they say I'm an angry person. How does it work for me? You're speaking your language and I'm speaking mine. So if we continue speaking in the language we want, it will not work for us. And disability, as you know, is not something that will come to somebody because of a cause or whatever. Accident can cause disability. And for me, it was just one injection that sent me to a world of silence. So it can happen to anyone. Let's not think about just us, people that look able to us, but let's think of something that could happen in the future. Yes, it was just one injection that took me to this deafness. It can happen to anyone. So please, let's make sure that health information is accessible to deaf persons through sign language, use of sign language in messaging. So, thank you very much.
Thank you. Thank you so much.
We can't avoid it.
Thank you, really, really appreciate it. So finally, Ma, I'll ask this one question to, close up the panel. What one message are you taking back to your fellow market women and men, at the end of this engagement today? Or so far, I know there are still going to be more conversation, but so far from what you've heard, what you know, what one message are you taking back to them, especially around health insurance?
Thank you very much, sir. You say one message.
Yes.
Market women is all over the Nigeria. It's plenty messages, not only one, like what my sister said. I believe our mama is a mother of grandchildren. It's a mother of graduates. It's a mother of, I don't know how to put mama. Mama is too much for Nigeria. I believe in mama that where this message come, mama will organize all the 36 states of Nigeria. We have all the 36 states of Nigeria. We have the leader. We call them as a meeting and they give them the message, and everybody in the state will go and work for the state. All the markets, both the village, we use Hausa, we use Yoruba, we use Igbo, we use Data, we use all the sort of language that everybody will hear, that know that this earth is very important for the market, for we women, especially we women, we mother. This earth insurance is very important for us. And we play that, let Nigeria to recognize the market women. Let them to know us, because I know and we believe our mother that we pass this message around all the Nigeria. And God will bless us in Jesus' name.
Amen.
Thank you, sir.
Thank you so much. Thank you, my amazing panelists, for sharing your thoughts and insight on this first panel. I really like the theme of this policy dialogue, accelerating. So it means it will happen. It will definitely happen. Okay? It's not about whether it will happen or not. We're just talking of how to accelerate it, how to make it happen faster for every Nigerian. So I really enjoy all of us as we continue this conversation to really take these messages to heart, take it to our communities, our directors, our colleagues, to see how we can keep pushing for inclusion, to see how we can keep pushing for universal health coverage for all Nigerians. Thank you so much.
Okay, please, I would invite the MD, Nigeria Health Watch, and the DG, NHIA, for a group photograph. Please join the panelist and the moderator. Very much. That was very engaging and interesting. Please, a resounding round of applause for the panelists and the moderator. Yes, we are having engagement also from our online audience, and we're glad they are participating and joining this conversation. I'll quickly take some comments. There are questions that have been directed to some of our presenters, and also comments from the conversations. Please, I'd like to request that we all settle down. Thank you. Let's settle down. We've been doing so well so far. One of the comments here from from our online guests says, are we talking about mandatory or forced health insurance? What are the incentives, palliatives put in place in the face of worsening national economy to encourage buy-in by the poor informal sector? Okay, that's more like a question. And then we have another comment. Why not make the GSM tax a certain percentage of every recharge? For example, if I make airtime recharge of 1,000 naira and the tax is, say, 15%, I would have the balance of 850 naira to do whatever I want with it. So online guests are making comments and also asking questions. There are a couple of other questions, and as we proceed, if we have more time, we would call on the presenters to address these questions. Without further ado, I would invite for the next panel session, understanding the roles and responsibilities of different stakeholders in the implementation of the NHIA Act. Please welcome the moderator of this session, the Director of Programs, Nigeria Health Watch, Kemisola Agbaoye. Thank you.
Hello, everyone. Good afternoon. Thank you for sticking with us thus far. If I may please request that we all settle down. I love all of the engagements and all of the dialogues happening in the different corners of the room, but I really would appreciate it if we settle down so we can hear some of the speakers as they share their thoughts. All right, so please join me as I make welcome my first speaker for this panel, Dr. Jonathan Eke, who is General Manager of Formal Sector at the National Health Insurance Authority. Please put your hands together for him. Secondly, join me as I welcome Dr. Jadesola Idowu, Chief Operating Officer of AXA Mansard Health Limited, as she joins us on this panel as well. Also join me as I welcome Dr. Oriseweimi. I really hope I didn't murder your name, sir. Okay. Who is Program Lead at MPHCDA for the Basic Healthcare Provision Fund. Please put your hands together for him. My fourth panelist is running quite late. He had an emergency and couldn't quite join us, who is the director of the FCT Health Insurance Scheme. But hopefully he comes in sometime during the course of the dialogue and can share his thoughts, even if he isn't seated on a panel now. So thank you so much, everyone. Thank you for agreeing to speak on our panel. This is a really important discussion to have, given the changes that have occurred in the law backing health insurance in the country, given what the NHIS Act said before and how that has changed into the National Health Insurance Authority Act. It is pertinent that the public and everyone understands how things have changed, what the different moving parts are, and how implementation would look like going forward. So that's what this panel is about, essentially. And to start us off in the discussions, I would like to ask Dr. Jadesola first. I'm a woman, I like to prioritize women. So first, there are two components of the NHIA Act that speak to third-party administrators. The first expands the role of TPAs, and the second restricts the actions of health maintenance organizations. So given how health maintenance organizations are actually third-party administrators, it might look conflicting at first glance. So can you speak to this and speak to how the conflicts can be mitigated?
All right, thank you. And thank you to the organizers and standing on all existing protocols. I really want to appreciate the organizers and all the panelists before us and the DG in absentia and the Royal Highness. In answering the question, really there is no conflict in the TPA administration because in the past, the NHIS actually did not give any place to the third-party administration or administrators. So basically, the HMO stepped in and fulfilled that role, but now they've actually highlighted the role for the TPAs. And actually what we now have is an expansion. So in the past, it was just HMOs filling that role that was not clearly spelled out. But now, we now have other TPAs that are recognized, mutual health associations, other TPAs of insurers. So basically, it's an expansion to achieve that universal health coverage for all Nigerians. Like we saw from that poll, 80% are not on any form of health insurance and they are on out-of-pocket payment. Now, HMOs are heavily vested on human capital, technology, database, information management technology that are already in existence, that are even being used, and in conjunction with state governments. For instance, Agzaman said we have a collaboration with Lagos State Government, Sokoto, Delta, Oyo State, and basically we are acting at the TPA. So basically what the Act is trying to do now is, instead of the HMO taking the monopoly as it were, now we have other partners and everything is all geared towards expanding the role. In the Lagos State program, what we call Lash My Lyrical, we are purely a TPA partner. The state government collects their premium, does everything. We are just vetting the claims. Vet the claims and then send it to their portal, and then it's paid also by them. So basically, they just pay us administrative fees as a third-party administrator, which is what will actually help state governments to expand the coverage across the states, and that's important. So there's really no conflict.
Wow, that's actually, that's quite, what's the right word, insightful, how you've explained what the role of third-party administrators are. And to expand basically on all of the roles of the different moving parts, I'd actually like Dr. Jonathan Eke, the General Manager of Formal Sector, to speak to what the different moving parts are. How are you coordinating all of these?